Welcome to the Jansen Journal In Depth, and today I have with me a guest who I just met recently, Jennifer Feuerstein, and she is very active in what I call care resources, and I'm going to let her kind of describe a little bit of what that is and kind of how did you get involved in this?
I was hired in about a year ago. The program, the PACE program that we run is not a very well-known program in West Michigan, and so they really needed somebody to get out and get the word out about this program, and so I brought my marketing expertise and my experience caring for aging grandparents to the table, and so I'm now going out and educating the community about the PACE program.
All right, in the PACE program, I was so intrigued because I had not heard of it, and I said I need to get you on my cable show so that others can hear about it. What's kind of the reason for what you do?
The whole PACE program, it started back in the 1970s in San Francisco with a program called Unlock, and it was in response to that in the Asian community they don't put seniors in nursing homes, and so they started this whole concept of adult daycare, and then eventually it grew to become a medical model and became permanent provider status with Medicare and Medicaid. And so the whole concept is to keep seniors at home and out of nursing homes for as long as possible.
So your goal is to help families keep a parent, grandparent, somebody in their home as long as possible.
Yes.
That's kind of the, which I find very exciting because I know lots of folks that I run into, they're looking for ways to help themselves stay
Right.
in their homes. There's a lot of reasons to do that. First of all, let's kind of talk about what you have going on and where it's at.
Okay.
How do people, once they do find out about it, what happens? How do they get involved?
Okay. The PACE program, like I said, started in the 1970s. Today there are 69 different PACE organizations around the country. In the last 5 years, the number has doubled, and so this is an incredible program to keep seniors living at home for as long as possible. In the state of Michigan, there are 4 PACE organizations. The first one opened in Detroit about 16 years ago, and we opened in October of 2006, and we cover all of Kent County. And then 2 other PACE organizations opened just this year, one in Muskegon and one Battle Creek. And so this program is really just, it's catching on because people are understanding the importance of keeping seniors at home. And the whole concept is it's a one-stop shopping medical model. And a person comes into the program, and there's some eligibility requirements, but once a person comes into the program, everything is provided for them. And so it relieves caregivers from the burden of having to get their loved one to doctor's appointments, set up the doctor's appointments, provide the transportation, pick up prescriptions. Everything is coordinated for them. And the eligibility requirements, a person has to be 55 and older. Most services for seniors start at 60, so it opens up that door a little bit earlier. They have to be able to live safely at home. They have to live in the PACE service area, and for care resources, it's all of Kent County. And then they have to meet the nursing facility level of care. And what that means is that they have some level of physical or mental impairment. It might be that they need help with bathing, dressing, feeding. They might use oxygen. They might have dementia, Alzheimer's. And so there's some level of physical or mental impairment, but they're still able to live safely at home with the help of caregivers, or that they really do live independently, but they use oxygen and they just need that added assistance to keep them living at home for as long as possible. A person also has to have either Medicare or Medicaid or be dual eligible, which means that they have both. Okay. For most of the population across the country, people are on Medicaid. Only about 4% of the people are on Medicare only. If a person's on Medicare only, then there is a patient pay amount that they have to pay each month to get these services provided to them. If a person is on Medicaid, they don't pay for any of the services. So there's no doctor's visit co-pays, no prescription co-pays. They don't pay for transportation, in-home care. They don't have to pay for anything. The only time that they would pay for something is if they had to go into a nursing facility for more than 30 days, then they would have a patient pay amount that they would pay based on income. But a PACE program covers everything for them, including a nursing facility for the first 29 days as far as payment. We care for the person from the time they enroll to end of life, no matter what their situation. So even if they have to go into a skilled nursing facility, obviously when we're dealing with the aging population, their health declines. And if they have to go into a skilled nursing facility, we still provide that care for them, even in a skilled nursing facility.
Now, your physical location is was very intriguing to me. Tell me a little bit about that.
Our physical location is actually in a nursing facility. They provide a continuum of care from independent living, assisted living, and skilled nursing. It's Holland Home, one of our community partners. We have 5 community partners, and they saw the need for a PACE organization in Kent County. And so the 5 community partners are Holland Home, HHS Health Options, Grand Rapids Dominicans, Metro Health, and Pine Rest. And they funded us to get us up and running, and they have all a vested interest in our success. And so Holland Home's contribution to us is that they provide the actual physical space for our day center and our health clinic.
What was also intriguing to me was that PACE, I'm not sure if there's employees with PACE, but all of these partners are providing the people to do all the services, and help me understand that again.
Okay.
For our viewers.
Okay. We at Care Resources technically don't have any employees. All of the people that work for Care Resources are hired by either the community partners or their contracted provider. We have about 175 different providers that provide services for our seniors. It's anything from durable medical equipment to the specialists that a person needs to see, and in-home health care agencies that provide the health care in-home. We contract with them, and then our core staff is provided through Metro Health, Holland Home, and HHS Health Options. And so it's this interdisciplinary team model where this team creates a care plan for the participant and oversees it, coordinates it, it's case management. And each discipline then puts their piece of the puzzle together to keep this person at an optimal level of health and independent as long as possible.
And on site you have lots of things going on, but again, intriguing to me was there's doctors on, or a doctor on site.
Correct.
Pharmacist on site. So if somebody's trying to stay in their home and they have all these, like you said earlier, all these things they have to do, prescriptions and doctor's appointments and all those, they really get a one-stop shop.
It is. It's a one-stop shopping medical model.
Allows somebody to be there on site, get to know a doctor that is very friendly, knows how to really work with somebody that might be a little bit in the aging process. I don't know, I found it very, very friendly and very, what I would consider inviting for somebody who wants to think about this, kind of begin to think about, someday I'm going to have to move out of my house, but I don't have to now. I can participate
right. And
in
hopefully
something
they
like
don't
this.
have to, and hopefully they're able to stay at home, till end of life.
So you have a lot of folks who are able to do that?
We do.
Yeah.
Yeah. Yep. And at our facility, we have our health clinic, and like you said, our pharmacy is right on site, so our participants get their prescriptions right there through us. We have therapy on site, so they get their physical and occupational speech therapy. We have our health clinic where they can see the primary care physician. We also have the podiatrist, the dentist, the audiologist come in and care for the participants right on site. And then we have what's kind of the hub of the building is our day center, and this is where our participants come in for all their social activities. The downside to aging at home is that seniors are confined to their own home. They're staring at the same 4 walls, watching TV. They don't have the mobility, they don't have the activities, and a lot of times depression sets in, and they're a mess when they come in. And so this day center allows them to be with peers. They realize they're not alone. Sometimes people have it worse off than them, and they realize, okay, it's not so bad. They have lunch when they're there. They play bingo. We have educational seminars. We do exercise classes. And it's just really a fantastic way for them to get out and get that activity in their lives.
And there was a farmer's market the day I was there, and
Yes.
a book sale going on outside, and a lot of, really a flurry of activity that, and I think a lot of smiling faces. It was just, kind of exciting to me, and then I ran into a couple of people that I know who, one volunteers there, the other one works there. I just, it was just kind of exciting to see all of that flurry of activity, and I think for somebody watching this, then the question is going to be, well, what's it going to cost me to be part of this, and is there a long lineup to sign up with, and so how does that process work?